Hello, everyone. This is PamelaTopjian. And if believing that the American healthcare system isn't truly about health care is a conspiracy theory, then call me a conspiracy theorist. I am a former nurse. I've never had a master's or bachelor's. I was a licensed nurse for 14 years. However, that is only a small part of what brought me to my belief that the healthcare system isn't truly about caring about our health. Not in the US anyway. But it's not the individual doctors or the nurses that I'm talking about. It's the system. Most healthcare providers care and they want what's best for their patients, but they are really limited by time, by the facilities that they work for and the companies that they work for, and probably most of all, the insurance companies. They also are only working with what they are taught during their education and during their training. Most of them went into healthcare in some capacity, whichever way that they chose to go into it, because they care about people and they want to help genuinely. And I do believe that. Now, let me add a disclaimer to this. So please do not take anything I say as medical advice or in place of any advice by your own primary care provider. And hopefully that person is a naturopathic doctor or a functional medicine practitioner. There is definitely a place for medical doctors, and thank goodness that we have them when we need them. More often than not, we probably don't. We as a society are brainwashed and programmed and highly influenced by the propaganda and the advertising. For generations and for decades, we've been fed over and over that you need a medication for every ailment or any discomfort that you're feeling. More and more over the years, this has become worse and worse, or really coming at us more and more. Of course, we didn't have TV long ago, and the doctor would come to your house, and a lot of times would just tell you, rest, stay hydrated, give them some homemade soup or whatever. But between TV and magazines and now social media, there's just so much coming at us. And medicine has big money to come at you and be in your face a lot of the time. Again, we absolutely do need some of these, but not nearly as many as people are taking. If you watch anything that has commercials or you see ads anywhere, there's always ads for medications. Ask your doctor about blah, blah, blah. Some older nurses in a nursing group were talking about how long ago patients would come into the hospital with complications from whatever disease, from diabetes, from cardiovascular disease, or with symptoms of unknown origin. But now they almost all have comorbidities, meaning more than one disease or more than one issue going on that they're managing or dealing with at the same time. Most, if not all, patients are being treated for several different diseases and or unspecific symptoms at the same time. And it wasn't always this way. Also, many more younger patients are being treated for issues that weren't seen in children or young adults many years ago. And much older people, they're treating things more aggressively than they used to. So they're keeping people alive, just managing the symptoms and medications, rather than really trying to improve the quality of life. Rather than that being the main focus, of can we make this person live a happier, healthy life? Their focus is just extending the life. I've talked before about quality over quantity when it comes to our lives that we lead as we age, and in getting things set up so that we don't end up being kept alive when we have no real life left, depending on your own wishes, of course. I have recorded a video on death and dying, and I'll put that link below. Another big issue is that doctors are not given very much information on true nutrition during their education. They are also highly influenced and programmed by the pharmaceutical companies, as already mentioned, and the insurance companies. Very few patients are given much information on lifestyle and how their food choices can affect their health. Those talks are maybe more often given to people who are obese, but not the general public who have these diseases that could have been prevented by some of these changes, or in lifestyle or food choices. When these talks are given to obese patients, it's more about losing weight and not as much about how can I have different food choices to get rid of my diabetes or get rid of the high blood pressure, the hypertension, or other things that, heart disease. It's more about just losing weight or maybe the joint pain or something. But these conversations need to be had with everybody. We should teach this more to our children and educate parents. But these conversations are very rarely had in the doctor's offices or in the hospitals. And do they have time? I mean, everywhere is almost understaffed, right? And most healthcare providers are overworked as well. There has been a campaign by the medical community against vitamins and supplements because they're not FDA approved and anyone could put something in a pill and hype it up, which is true. However, if you search the side effects and the deaths caused by pharmaceuticals, even when taken as prescribed, we're not talking about overdoses or taking things that they're not supposed to take. It's going to be shocking. So look that up if you're a numbers person and a statistics person. The money for studies on new medications or disease research is more often than not given by those who make and sell the drugs. Yeah, let that sink in. The money for these studies on disease research and medications are given by the people who make the drugs. There are studies that have not been allowed into the medical journals because they go against what the pharmacological companies have promoted. There's a number out there too. You can have 3 studies proving something before you can start to get changes made. But if you have 10 studies and they all show one thing, but 3 of them show the thing that you want it to show, that's all you need to promote it or get that ball rolling or get the money for it. If you've got 3 studies, those 3 studies can go into the journals, research can happen, drugs can be made, but no matter how many other studies show the opposite. So there's information out there that shows that too. So again, if you're a numbers and statistics person and you need all that information, look it up. I'm going to put some names of some of the documentaries that are out there that will have that information in there. They will tell you that overdosing on any vitamin can cause adverse side effects. Yes, that may be true. However, overdosing on any prescribed drug will as well. Almost all prescribed medications are toxic to the liver. It's an overload of chemicals. When they insist that you take with food or water, it's not just so that it doesn't cause stomach upset. Let me just say here another sort of disclaimer. Please do not stop any medication without consulting your healthcare provider. It can really do some serious damage with some of the medications if you just stop them abruptly. But if you're going to make changes to try to get off your medications, just ask for your vitals and ask for your labs. And after 3 to 6 months or a year of living more healthy, ask for them to be checked again and then see if you still need the medications. You can do a medication review with your doctor and you can go over what is needed and what isn't needed. And sometimes people find out they're taking 2 or more medications that are doing the same thing and they can knock that down. Or let your doctor know. I mean, I think it's a good idea to let your doctor know, hey, I'm going to try to be changing my lifestyle a bit. I'm going to work towards getting off some of these medications. So can we check my blood labs more often, check my vitals, do all these things that are going to make sure I still need these medications as we go through this year. Something like that. There are some people who do much better to make those big changes right away, all at the same time, and others do better just by doing slowly, adding more good things while slowly eliminating not so good stuff. I am not perfect, nor am I the epitome of health. I am working on it though, especially as I age, but I'm not perfect. There are so many documentaries that can give some good information. So much more than my little rant here. And like I said, I'll share that list in the description box of this video below. So Hippocrates said, "Let food be thy medicine and medicine be thy food." Look in your refrigerator, your pantry, and your cabinets, and notice what foods are there that our ancestors would recognize. Meaning, would they even know what it is or recognize it as food? Don't look at the front of the packaging to see what's in it or to decide if it's healthy or not. Notice what's in the ingredients list in the back in the small print. Oftentimes, it's a long ingredient list that you probably don't even recognize most of the words in there. Again, I'm not perfect, but awareness is the first step. It's about progress and not perfection. Do your best. And as Maya Angelou said, once you know better, you do better. She wasn't necessarily talking about food, but that quote really fits for all aspects of our life. In 1971, millions of dollars were given by the government to go to cancer research, known as the War on Cancer. And even though they did learn a lot more about cancer, the death rates have not improved. The studies that tell you they have, it's just for a 5-year window. So if a cancer patient lived 5 years after the cancer diagnosis, they can legally and medically say they are a survivor, even if they died in that 6th year, or even if those 5 years were just, they weren't living, they were just trying to manage the disease and had a horrible time, sick and weak and everything for those 5 years, and they died the 6th year. They can legally and medically say that person is a survivor. So be really careful when you're looking at numbers and studies and just what you read and hear. And I mean, that goes for me too. I don't have education in this stuff. This is from watching several documentaries and reading as well. So we're all going to die anyway, right? So what's the use? Or some will say, I want to enjoy my life by eating and drinking what I want and what tastes good. Since those who eat healthy and jog every day or go to the gym all the time will die just the same as those who don't. And as I already mentioned, I recorded a video on death and dying, and I'll put that below. But it's more about being healthy while you're still here, about preventing these diseases so you can be comfortable, happy, and have the ability to do what you want and not to have to manage your doctor appointments, your symptoms, and your medications throughout the rest of your life. Many processed foods have addictive substances added in them. So it doesn't take too long to get over that addiction and lose your cravings for those foods once you start weaning yourself off of them. But this video wasn't supposed to be as much about food and diet, but more about the healthcare system not really caring about health care, not really being about health care. But what we eat and put in our bodies is so much more important and plays a huge role in our health and in our own, responsibility for it, taking responsibility for our own health and well-being and not relying so much on running to the doctor for every little thing or thinking you need a pill for every little thing. So many of the prescription drugs taken could be avoided by changing diet is all I'm saying. And, not even mentioning the money, right? How many people are choosing between paying for their medications and paying for food? And that's another issue too then. They're taking the medications and they're skimping on the food because they can't afford, they need something that's cheap and fast and easy because they're paying for these medications. Any company that sells you a product wants you to come back for more, or they will go bankrupt, right? Pharmaceutical companies are not nonprofit companies. They are trying to make money. Again, just notice the ads and the commercials. In my opinion, they don't want you to be well and healthy. That's what this video is about. They don't really want you to be well and healthy. The individual doctors, the individual nurses, a lot of them, most of them care and want to do right by you and want you to be well and healthy and happy. The pharmaceutical companies, which control so much of the healthcare industry, as well as the insurance companies, don't really want you well and healthy. So much of it is money focused. And it's not just pharmaceutical companies and the insurance companies. Well, insurance plays a big part of it, but I've seen firsthand where the patient's health was put at risk by keeping them in a facility just because they had good insurance, even though they either could be released on their own or, on the other hand, needed a higher level of care that the facility they were in couldn't provide. I've seen this firsthand over and over. I know that I have maybe overemphasized that our diets play a huge part in our overall health and well-being. However, so does managing stress, having good connections, happiness, processing through old traumas, and working through our emotions. Lifestyle is more than just what you eat. Also, let's add alcohol and smoking and vaping into all of that. That's part of your lifestyle. I may sound a little radical or unhinged, but I am so passionate about this, and I really think we all deserve all the information so we can make informed and maybe even educated decisions about our own health and well-being. That's what I really want, is people to have the information so they can decide for themselves what's right for them. So, like I said, I'm going to put the names of many different documentaries below. And also, I have a podcast, in case you didn't know, Holistic Connections, Conversations with Holistic Practitioners. And there is a playlist on this YouTube channel where I have the video form, but it's also on most podcast platforms. As I said, I'm not trying to really change anyone or convince anyone of anything. I'm trying to encourage people to do their own research, to make informed decisions, to be more mindful and aware when it comes to your own health and well-being. So, who the heck am I? Nobody of importance, right? But please check the list in the description where more educated and knowledgeable people who are sharing this information and the documentaries to learn so much more. Although I'm not fully on board with everything from the list of people in the documentaries that I'm going to put below, but they're all worth looking up, and you can make your own decision on what feels right and will be best for you. So thank you so much for being here. If you've watched to the end, thank you so much. And if you've watched to the end and you enjoyed this at all, please subscribe if you're not subscribed. I think I have a little button on one of these corners that if you just click that, it'll take you right to the channel. But there should be a little subscribe button for you to hit under the video as well. As always, I wish you all so much peace, so much love, and healing.